to an episode of the Prime podcast series. So I'm Alana, I will be chair on today's podcast where we will be discussing HIV and AIDS. Very fortunate to be joined by two wonderful speakers today, Baxter and Gertrude. So Baxter, would you mind just introducing yourself and just giving us a bit of a background about your work area?
I'm Griphin, Baxter, Chirambo. I work with Mzuzu University, and I work in the nursing and midwifery department. That's where I do teach. Yeah.
Amazing. And would you like to introduce yourself also, Getrude?
I'm Getrude Munthali. I also work with the Mzuzu University, but to be specific, in the nursing and midwifery department.
Amazing, thank you. So,
yes. And I'm also involved in teaching HIV and AIDS as a course.
So you're an expert on it. So we're very lucky to have you on board. Hopefully you'll be able to answer lots of our questions. So I suppose I'll get straight into it, and I'll give just the listeners a brief definition about HIV. So according to the World Health Organization, they define human immunodeficiency virus, which is HIV, as an infection that attacks the body's immune system, specifically targeting the white blood cells, which are called CD4 cells. And HIV often destroys these cells, which weakens a person's immunity against infections, and infections could be such as tuberculosis or fungal infections. And then on the other hand, AIDS stands for acquired immunodeficiency syndrome and is often defined as a chronic, potentially life-threatening condition that is caused by HIV, and it damages the person's immune system and interferes with the body's ability to also fight infection and disease. So with that definition given, I suppose the first question that is always important for our listeners might be, how can HIV be transmitted, or how do you catch HIV infection? Gertrude, would you like to answer that question first?
Yes. There are so many modes as to how HIV can be transmitted. But the most important one being through unprotected sexual intercourse with an infected partner. But someone can also catch it from mother to child. It can also be transmitted through blood, through needle prick injuries, especially healthcare workers can get it through that mode. It can also be transmitted through transmission of infected blood from an infected person to someone who receives blood which has not been screened properly. So those are some of the commonest ways as to how someone can get it.
Great, thank you. You've touched on some really great points there, and I think it's important for our listeners to be aware about transmission. Baxter, I think we've kind of covered everything there, unless you have anything else to add. I mean, Gertrude went into great detail there for us.
Well, I think most of it has been covered. Maybe just one more thing. In case if people share razor blades, because it can carry some blood, so razor blades can also help transmit HIV/AIDS, and also toothbrushes. It can also be a mode of transmitting, but otherwise, most of them has already been covered by my colleague.
That's great. Thank you, Baxter. So HIV symptoms, I know it can be quite hard to describe sometimes, symptoms of certain diseases, depending on disease stages and stuff like that. But would you say there's any, I suppose, pertinent symptoms of HIV that a person could look out for if they believe that they're potentially have the HIV infection? Gertrude, we might go to you again on that one.
As you have rightly put it, it depends on the stage of HIV. We find that in the initial stage, somebody is asymptomatic, where they are not presenting with any signs and symptoms. But as the HIV is progressing, they might present with multiple symptoms. The commonest one being maybe cough or shortness of breath, which might indicate respiratory problems. They can also present with headache, maybe confusion, if maybe they are having maybe meningitis. They can also present with diarrhea, or they can present with enlarged lymph nodes. They can also present with mouth sores and even rash on the body, and sometimes even with what we call herpes zoster, where they may develop blisters in one dermaton, symbolizing that they have an HIV-related condition. So there are multiple anyway, depending on the stage of the HIV.
Yeah, no, it's really interesting that you say, obviously, some people, yeah, they might not be even aware that they have HIV because some of the symptoms are just like the common flu-like symptoms, I suppose, that you might catch. So they might not even feel sick straight away. So I suppose in that case, it might be important to get tested as well. So Baxter, is there anything again that you need to add just in terms of symptoms of HIV?
Okay, well, because the HIV attacks the immunity of someone, so somebody sometimes can also present with some flus which are failing to get cured, and some other conditions. Mainly, someone might be complaining of general body pains time and again, just because their immunity have been compromised. But otherwise, most of the symptoms are the ones which have been highlighted.
Yeah, so it might take a while, I suppose, for symptoms to be prolonged and perhaps indicate that HIV infection is present. So I suppose, you know, symptoms is maybe the second stage, but initially, I suppose the most important part will be how HIV can be prevented. Would you say there's any effective ways to reduce your risk of getting HIV? Gertrude, we might again, sorry, go to you on this about HIV prevention.
We're happy that the preventive measures are also many. So people are free to choose from the multiple ones. The most effective ones being the abstinence, where someone chooses to delay sexual intercourse, especially when they're not in a stable relationship. And even those who are not yet maybe married, the young ones. So what we are preaching is, if they can delay, the better, because that is the most effective one. And if they cannot delay it, if they cannot abstain, the other way is to use condoms consistently, where every time they're having sexual relation with somebody they don't know well, they should use condoms. And those who are actively sexually active and they may not maybe consistently use condoms, nowadays we are putting them on the ARVs, what we are calling PrEP. So they take these ARVs before they are infected so that they cannot acquire HIV infection. And the other effective mode is through community awareness. Because people sometimes they get or they acquire HIV because they do not have knowledge on how one can get HIV. So by educating our masses, our population on how to prevent HIV, the knowledge itself acts as a preventive measure. So community awareness is also critical when we're fighting HIV infection. The other way is through provider-initiated family planning, where we're advocating those mothers who are positive to follow family planning so that they do not get unintended pregnancies. In this case, we're preventing transmission to the newborn babies through family planning. The other way is through early detection of HIV in those who are positive, so that they begin on ART or ARVs, so that their HIV viral load goes down. So the moment they suppress the HIV infection in the body, it means even if they get pregnant, the risk to transmit to their unborn babies are reduced. And again, the onward transmission to their sexual partners is also reduced. So ART, much as it is a cure, it is also a very effective preventive measure, because those who are put on the ART, the risk is reduced to transmit to sexual partners as well as to the unborn babies. Again, through infection prevention measures, especially during labor and delivery. So mothers who are positive and are also pregnant, as they are delivering their babies, there is need to follow effective infection prevention measures so that there is no risk to transmit to their newborn babies. So all those highlighted modalities can be used to prevent HIV.
Yeah, definitely. And I know obviously initially we might go to the obvious ones, which would be, you know, using condoms or abstinence and stuff like that. So it's actually really interesting that you touched on community awareness and the knowledge aspect of it all, because often I think it's not something initially we might think about, especially where I'm from over here in Ireland. Sometimes I have, you know, promotional campaigns, and I think it's really important to definitely be raising awareness on it, and often the stigma that can be associated with HIV infections. Baxter, again, Gertrude did an amazing job there, but do you have anything else to add in that regards?
Well, I think the major things which have been said, I can just add to say prevention mainly is to help people abstain, because that's the major way of contracting HIV. And to those who are failing to abstain, better use condoms, or else they should be given PrEP, as it was mentioned. But the others, because the rate of infection is low, so we can't advocate much on them, but the major ones are the ones which I'm talking about: abstinence, use of condoms, as well as maybe a use of PrEP. At the same time, as she highlighted, the infection prevention measures, more especially when delivering, when a mother is delivering, that would also help. At the same time, we can also talk of giving the mother, the pregnant mothers, they are giving them some drugs so that as they are delivering, they should reduce infecting the baby. So those are some of the means of preventing. Yeah.
Yes, definitely. Yes, I know our healthcare system over here as well has the pre-exposure prophylaxis and also the post-exposure prophylaxis if you've been exposed. But I think, again, what's really important, Gertrude, what you mentioned is knowing your HIV status and getting tested. So I suppose that'll lead me on to the next question, is how would someone get diagnosed with HIV in Malawi? So yes, Gertrude, again, I might go to you on it as to begin with.
Okay. One can only know that they're HIV positive if they have been tested. That's the only way. And in Malawi, we're using 2 types of HIV testing. We're using the antibody HIV testing and then the virologic HIV testing. With the antibody HIV testing, we're isolating the antibodies to HIV in the blood. So as the moment we isolate antibodies to HIV, it confirms that that person is infected with HIV. And in other individuals, especially the children below 1 year, we're relying much on the virologic HIV testing, which isolates the actual HIV virus in the blood. And we're using the PSR, the DNA PSR in Malawi. So those are the 2 reliable tests that we're using currently in Malawi, and it is available in our hospitals.
Yeah, thank you. Yeah, it's definitely important to know your HIV status, because I suppose it allows you to get the information you need and also to keep you and your partner healthy. I know over here we do have home testing available that you can purchase from a pharmacist. which is a really, really good idea. It's obviously easily available then. And Baxter, I suppose there's probably nothing else to add on that. Gertrude's doing an amazing job of covering everything.
Yeah, she has covered everything, because even here, there are some other people who can go to the pharmacy and buy some test kits, but what they are doing is what she has already explained. So much that they are testing on their own, but they are still using the same diagnostic tests, which Getrude has already explained.
Yeah, exactly. And it's essential, I suppose, to be able to get the treatment you need, and to live a healthy life. So I suppose that goes on to the next question, leading into HIV treatments and services that are available within Malawi, and I suppose again what governments can do for those with HIV. So Baxter, will we go? Do you want to go first this time? Yeah.
Okay. On the services which are being provided, the moment someone has been tested positive, okay, maybe I should say the first thing is someone that should go for testing, and after getting positive this time, it's advocated that someone starts ART forthwith, and that helps to reduce him developing AIDS conditions. So the government is also, there's a lot of community awareness in terms of prevention of HIV. So both in community, in schools, in hospitals, when mothers go to the antenatal clinics, they get the awareness on how they can prevent HIV. Yeah, so mainly it's through the awareness campaigns and like, yeah. I think Getrude can add.
Thank you, Baxter, for that. And Gertrude, do you have anything else in addition to those, just in regards to HIV treatments?
I think the major one is what he mentioned. Everyone who is HIV positive now, that started on ART, because evidence has shown that early treatment is quite critical. It outweighs the side effects that somebody may develop as they're taking ART. So it is very important for an individual as well as for the community. For an individual, it prevents him from developing HIV-related HIV conditions, which might result into untimely death. It is also important for the community because, as I said, it prevents onward transmission to sexual partners and to the unborn baby. And then we also have what we're calling preventive services for HIV-infected people. And the government has isolated the three main preventive services. These are provider-initiated family planning, where all HIV positive patients are encouraged to start using family planning, basically to prevent unwanted pregnancies, which have got consequences. And then the second one is what we call Mzuzu preventive therapy. So as much as they're taking ART, they're also being given Mzuzu, which they also take every day. This one prevents respiratory conditions. It also prevents them from developing malaria infections, which is endemic also in Malawi. The third one is what we're calling TB preventive therapy. We know that people who are HIV positive, they're prone to HIV-related conditions. And the main one which are killing our HIV positive people is TB infection, as well as the cryptococcal meningitis. So to prevent that, people who have been found positive, the first 6 months, they're put on what we're calling TB preventive therapy. So they also get TB drugs to prevent them from developing TB. They are also screened for cryptococcal meningitis, so that if they are also harboring cryptococcal, they have to be treated before they can start exhibiting symptoms. So those are the three major preventive services that are available for HIV positive individuals.
Thank you. That's great. Yeah, it seems like there's obviously a wealth, I suppose, of services available, which is actually really good to hear, because obviously HIV can be treated effectively with antiretroviral medications, you know, if given at the right time and setting. And I suppose it's great that it can stop HIV from reproducing in the body, but again, it's when it's taken properly. So I suppose, you know, that's really important as well for someone to know that you do have to take your treatment as directed. Otherwise there is a chance obviously that, you know, the person can still pass it on to someone else, which further, I suppose, leads to more infections and an elevation of the problem. And I know that we're very fortunate here in Ireland that HIV treatment is free and available in numerous hospital settings throughout our country, which is really, really exciting. And there's also pediatric care available in the children's hospitals, which again is just very nice to know, and reassuring that we're going in the right direction. I suppose we've covered a lot about HIV, so we might just move on then to AIDS. Obviously that's more of the chronic side of things, and maybe some people don't know that there is the connection that HIV develops into AIDS. So we might just move on to, I suppose, this area. And I'll just ask you maybe, Gertrude, how does HIV develop into AIDS? I think it's very an important area that's important to discuss on the podcast today. So if you want to go ahead with that, just how about HIV progression into AIDS, that would be wonderful. Thank you.
HIV, as you earlier mentioned, is a virus that when it successfully enters into the body, it targets the immune cells, especially the CD4 cells, which are very active in the body to prevent someone from infections. So once the CD4 cells have been infected, during replication, you'd find that most of the CD4 cells will be destroyed, especially if we follow the life cycle of HIV. During budding, most of the CD4 cells will be destroyed. And as they're being destroyed, if there is no treatment, most of them will be wiped. And somebody will go into a situation where we'll be talking about reduced CD4 cells. And once most of them that have been wiped, it means the body now is prone to what we are calling opportunistic infections. These are infections whereby when somebody has a very competent immune system, they do not cause infections. But in an immune compromised individual, these opportunistic infections now start causing overwhelming infections, which we are now referring to as HIV-related infections. Examples would be the cryptococcal meningitis, the toxoplasmosis, the chronic diarrhea. So all that can come in and then start causing havoc in the life of an individual. So when now they are prone to these opportunistic infections, that's when we say that somebody now is gone into AIDS stage, where now they're presenting with different opportunistic infections. And it is these opportunistic infections, when they're not dealt with, that the ones now which may now cause death in an HIV positive person. So briefly, that's how I would sum it.
That's great, thank you. Yeah, so you've really touched on it, that you're more likely to develop diseases that won't usually cause illness in a person with a healthy immune system, but in someone with HIV, then it can lead to more, I suppose, drastic or life-threatening outcomes in terms of developing opportunistic infections, or even cancers as well can often occur. Baxter, again, anything else to add, or do you think we've covered it all?
Well, she covered a lot, but what I can just add is that naturally, a human being is supposed to fight against diseases. or infection in the body. And as she rightly said, HIV, once successfully enters the body, it targets the immunity of an individual. And as such, one fails to fight against the infections which can come. That being the case, even the conditions which someone would have fought against, he fails to fight. And then in the end, that's when we have these chronic diarrheas, what do I call? Okay, the cryptococcal meningitis, the TBs, all those things. Now that comes because the body has failed to fight against those infections. And in that stage, now that's when we call someone to have AIDS. Because initially, somebody was just attacked with the HIV. Yeah.
Thanks, Baxter. Yeah, that's very informative. I suppose we're fortunate that access to better antiviral treatments has decreased deaths from AIDS worldwide, which is very promising. Although I was looking, I suppose, at some figures and stuff like that, and obviously Africa still holds the greatest burden in terms of HIV infections. They harbor most of it. Obviously, despite, only accounting for a certain amount of the world's population. So I was just wondering then, would you give us, I suppose, a brief insight into perhaps some measures that might be due to the fact that the low to middle income countries carry the heaviest burden of certain HIV related infections, whether it's caused from, not sustaining, so not practicing abstinence, or even drug related. I suppose, why are cases still so high in certain low to middle income countries, as opposed, I suppose, to other, European regions? Now, it might be a difficult one to delve into. Gertrude, if you have any indication, I suppose, or your own opinions about what potentially might be causing cases to be so high, that would be great. Thank you.
Yes, evidence is still showing that in low and middle income countries, we still have high cases of HIV. Much as there are all these strategies on how to prevent and treat HIV, we're still battling with very high levels or high numbers of HIV infections. And we're also still registering new HIV infections, meaning we are not in the battle. So when we're managing HIV, we talk about two main factors. We have what we call the inhibitory factors. These are factors which act against HIV infections. And these are the ones that we talked earlier on, the condom use consistently, the abstinence and the like. But we also talk about the facilitating factors. And these are the factors that promote HIV transmission. And in middle income countries, you would find that though people are aware of condom use, they still do not opt to use it consistently. So maybe it could be driving the transmission. You'd also see that there are also other behaviors which are fueling the transmission of HIV. For example, males having sex with males. So you'd find that anal sex compared to vaginal sex, anal sex promotes or fuels the transmission of HIV. And nowadays we see so many couples, male couples, indulging in sexual relations. So it could also translate to more cases of HIV. The other thing is maybe culture-related factors, where you'd find that other cultures that are still promoting things which may fuel transmission of HIV to put it in perspective, you'd find that maybe someone who has lost a husband, they would maybe ask another male to sleep with that woman without knowing whether she's positive or not, and it is regarded as the cleansing in their own culture. So it is still happening, though people are aware of HIV. The other thing is, nowadays we talk about medical male circumcision. It is available in our hospitals where males can access such interventions, but many men are not forthcoming to go and have medical male circumcision. So though the strategies are in place, but other people are not accessing those services yet. That's why maybe we are seeing high numbers of new HIV infections in our setting. Maybe just to mention a few.
Yes, definitely. There's obviously behavioral and cultural factors that are likely to contribute to higher numbers. And Baxter, is there anything else to add on that point?
Well, I think as she has said on behavioral issues, I will add on our maybe myths, I should put it like that. There are some other people who possibly do not use condoms just because some of them, they believe that using condoms maybe a condom can remain in a lady, in the vagina. So as such, some ladies would prefer not to use condoms. Some other people would not use condoms just because they say they react to condoms. So because of that, they would also prefer not to use condoms. And then there are some other people, as she rightly said, they might not go for testing. And as such, they don't know whether they are positive or not. Because they haven't gone for testing and they don't know, they would go around possibly spreading HIV. So that would also show the transmission of HIV. And then also delay in going to the hospital to get tested. And there are a lot of people who would prefer to remain at home or to use over-the-counter drugs whenever they feel sick. As such, they don't go for testing. Because they don't go for testing, they don't know that they are positive, and as a result, they continue spreading. So those are some of the things which would increase HIV transmission in low and middle income countries.
Yeah, and I think
she said she remembers two more.
Oh, very good, thank you.
The two more important factors which I didn't include, non-adherence to ART. Because ART, to function effectively, one has to adhere. So during monitoring and evaluation of HIV patients, you'll find that other individuals are still having high levels of HIV, meaning that the HIV has not yet been suppressed. So because of that, it means there's still a risk in the community. They might be transmitting the HIV to other sexual partners. And the other one is that there are high numbers of people who are being diagnosed with sexually transmitted infections. And there's a big connection between STIs and HIV, especially the ulcerative type. So once people have STI, the chances of them getting HIV is very high. So now that the STIs are also very high in our community, this link between the two might also explain the high levels or the high numbers of HIV in our society. Thank you.
Yeah, thank you. Because I think what you've both really highlighted here is that there isn't, I suppose, a single factor that could account for high HIV prevalence in certain countries, because there's such a realm of factors that could contribute. And whether, like you mentioned, it's behavioral, cultural, or social. we can't pinpoint to one certain area, but we could definitely, I suppose, raise awareness surrounding factors that might potentially lead to an increase in incidence and prevalence of HIV in certain countries, which I suppose is kind of very similar to what I was going to ask next, and that was to do with obviously the Sustainable Development Goals. The third goal is to eradicate AIDS by 2030. And I suppose I'd be wondering, what would your opinion on that? Do you think it could ever be eradicated? And I know it might be a difficult question to ask. We're in 2023 now, so I suppose still 7 years to go until we're supposed to meet that goal. But I wonder what is your opinion on whether, do you think HIV could be eradicated, or AIDS itself could be eradicated, but HIV infection might still be around? Gertrude, if you want, again, to just go straight into that question. Thank you.
I think it is possible to eliminate HIV in our community. We have to remain optimistic. That's the only way to win the war. For example, in Malawi, ART became universal in 2016. And by then, our goal was to have 90% of the individuals tested for HIV. And out of the 90% tested for HIV, 90% should be put on treatment. And 90% of those put on treatment should achieve viral suppression. Because currently we view ART as the most important preventive measure. And if you look at evidence, most of the HIV positive people were also children. And the moment we eliminate pediatric HIV, in the future, we might eliminate HIV in our society. And ART is our only hope to eliminate pediatric HIV in our society. And as for Malawi, you'd find that by the year 2020, we had achieved that goal of 90-90-90. And the strategic plan for Malawi is that now, from 2020 to 2025, we have moved from 90-90-90 to 95-95-95. In this case, 95% of the population should have the HIV tested, and 95% of those who would test positive should be put on treatment. And then those who are put on treatment, 95% of them should achieve viral suppression. And if we can surpass the 95-95-95, it means we're closer to 100%. And the moment we get everybody tested for HIV and everyone who tests positive put on treatment, and then we monitor the treatment so that everybody achieves viral suppression, I'm very optimistic that by 2030 or beyond, we should have a HIV-free generation. And I believe it is possible. So apart from just talking about HIV testing and HIV treatment, if we also promote awareness where every individual knows about HIV and knows how to prevent it, and then we make available all the health care services which work against HIV, for example, medical male circumcision, HIV testing and treatment, condoms be available in all the places where people can get them. I believe one day we should have a free HIV generation.
Definitely, that is very promising news. That hopefully through good public health measures, infections will decrease, and also obviously good education to stop HIV, I suppose, the epidemic that it is. And I suppose we still just need to do more about raising awareness and increasing public health measures. But it seems like you are on the right track over there in Malawi. And Baxter, do you have anything again just to add to that?
Well, I think the major word here is being optimistic. And as Shiraikwe said, we're optimistic that possibly one day we're going to achieve that goal. However, I might just differ on the year 2030. It might be close, but at least thereabout, we might be able to achieve the 100%. I'm talking about this because we're talking about 2025. That's when we have to achieve at least the 95%. And then with the next 5 years, my worry is the number of years might just be few, but if you can intensify the measures which have been highlighted, I think one of the days in the near future, we can have an HIV-free generation. Yeah, so very optimistic on that.
Yeah, I know that it's actually very nice to hear that we'll be ending on a good note, I suppose, in this podcast, and just for our listeners to know that the strategic direction is promising in terms of raising awareness, interventions, delivering the services, and I suppose innovation, and also hopefully, you know, funding and financing for more or widespread availability of treatments, and also in terms of maybe even developing, I suppose, vaccines for those that do have HIV. It hasn't happened yet, but I suppose the way the world is going at the moment, it is very promising, and hopefully one day we will achieve the goal. Like you said, you don't know exactly when, but hopefully in our generation anyway, we'll be able to see hopefully the eradication of HIV and AIDS. And we're definitely on route to that target anyway, which is great to hear. So I suppose we've really come to the end of the podcast. And I know obviously there's no cure for HIV or AIDS at the moment, but medication can control infection and progression of disease, and it has reduced AIDS worldwide. And I just wonder, do you have any closing remarks for our listeners in regards to HIV and AIDS? Any lasting things that you'd like them to remember? Gertrude, if you want, I could start with you again, just about any closing remarks or comments for our listeners.
I would conclude by saying that HIV is real. And if you look at the history of HIV, I think we should be very grateful that a lot has happened. Though we lost a lot of people to HIV in the initial stages of HIV infection, because by then there wasn't any effective measure to fight HIV disease. But now we're happy, at least those who are positive, something can be done and life can be lengthened. They can also live like anyone else if they follow whatever measures that are present. But maybe we have not reached the end of everything. We should still look for the vaccine. And again, people should still strive, the scientists should still find a cure for HIV. Because when you work in the clinics where we are managing HIV positive patients, you would find that there are people who have been taking ART for maybe closer to 20 years now. And they're exhausting. They're exhausted taking tablets every day. And you can see it in their face that they're tired. So maybe God should guide us so that in the future, the cure for HIV should be found so that we can deal with this public health condition. Thank you.
Thank you. And yes, Baxter, any closing remarks or comments from you?
Well, I should just tell the listeners out there to say HIV is real, it's there, and then the major advantage is it is preventable. So someone can prevent from catching HIV, getting HIV, through being abstaining or using condoms or having PrEP. At the same time, to those who have been tested, my major message to them is that they should adhere to treatment. By adhering to treatment, they will remain healthy throughout their life. And To those who have not been tested, I should encourage them to go and get tested. It's only then that they can know that they are free from HIV or they have HIV, and they can take another step from there, only after getting tested. Without that, they would not know. I should also encourage mothers, pregnant mothers out there to use the hospitals, to go to the hospital for delivery. Because if they go to the hospital has trained personnel who are going to help them deliver so that they should not transmit the HIV to their young ones. Yeah, basically, that's the message which I can have. Thank you.
Well, Baxter, Gertrude, you have both been wonderful today. It's actually been a really interesting session, just even for myself, listening, I suppose, to your points and perspectives from a different country. It's always really interesting to hear. And I am very grateful that our listeners as well get to have, I suppose, a snippet insight to HIV and AIDS, and hopefully we'll be able to reach a wide audience and everyone will benefit from it.